over to you.
Good morning, everyone, or I guess good afternoon for most of you, for many of you. So I'm Sarah Gladstone. Thank you, Tracy, for the introduction. And I'll talk with you now about the Wolfram Syndrome Global Patient Registry. This is a project actually funded by the Snow Foundation and being supported by the National Organization for Rare Disorders in the United States. Just a little bit about the background of this project. For a number of years, Stephanie Snowgebel of the Snow Foundation had been thinking about starting an international Wolfram Syndrome patient registry. And a couple years ago, I had been advised by some folks heavily involved in pharmaceutical research and the general research community that having a readily accessible patient registry worldwide could really help us with patient recruitment should a treatment opportunity or clinical trial opportunity arise. Those of you who were in the talk by Dr. Yue Man this morning heard him talk about patient recruitment, which means the ability to bring patients in for a clinical trial, that this can be a major bottleneck at times, really limiting the initiation of a clinical trial. So with this understanding, Stephanie and I discussed how could the Snow Foundation sponsor a global international registry, especially in the world of an ultra rare disease. We knew that we would need to reach out worldwide to have the best chance of getting the most patients with the most different presentations and histories involved. She met with the National Organization of Rare Disorders, this very well-known group in the United States, and decided to partner with them to establish this registry. The reason for partnering with NORD is that they have done this before. For many rare diseases and ultra rare diseases, they know how to set up a very well-run patient registry. And we thought we would not try to invent that ourselves, but to rely on the people who do it best. The aim of this registry then is, and you can, I think, Tracy, do you have the screen share up there with the written information? And we have the written information up just to make it a little bit easier, because I know for some folks who may be speaking a different language as their first language, having the written word may be easier. I know it is for me. So the primary aim of this is to, it says here, conduct a prospectively planned and efficient natural history study. So we want to look going forward at our Wolfram syndrome patient population, not looking back, but looking forward at how this disease evolves over time for people. And we want to get a better sense, we all want to get a better sense of how this disease evolves over time, what the pace is for different genotypes, meaning people with different kinds of mutations, and different phenotypes, meaning how that genetic mutation is expressed. So we want to look going forward. So this is one important part of the registry. We want to allow our Wolfram syndrome patients and families to be able to self-report their disease. We also want to be able to have easy communication with our international patient population about research studies and clinical trials. So in one country, if there's an opportunity for a trial or study, we really want people worldwide to be able to be aware of this. We would love for everybody to have a better sense of our population as a whole. How common is this disease? Again, how does it show up in different patients, in different families, and how quickly does it progress? Again, something Dr. Yue Man addressed this morning. We can look at patterns across our entire patient population. And again, that's really, really hard when you have an ultra rare disease. We really have to look worldwide to get a reasonable number of patients to understand this. We want to help our entire community to develop recommendations of how best to care for this disease, standards of care, so that if in one country there's a supplement or a treatment or a technique that's working, others in other countries or other areas of a larger country will be aware and can also participate in using that treatment or that technique. For some groups who want to develop a treatment, there may be, this is our next bullet point, we want to be a case-finding resource, meaning for people with different mutations, different treatments may be applicable. So there may be some treatments that work well for one type of mutation. There may be some treatments that work well for another type. We want to be able to reach out to different people with different mutations so that we can understand the pathophysiology of Wolfram syndrome, meaning how the mutation itself causes the disease and how to help different people with different mutations by intervening with treatments or support. And then there may be drug companies, if they feel they can help a specific type of gene mutation with a novel treatment, we would be able to readily find those patients through this registry. One thing that we also talked about was that this would be a very lengthy process to get a registry set up. I had a hope, a false hope that we could have this ready in a couple of months and get going. It is a long process to establish a registry. We began about a year ago in earnest setting this up with NORD, and everything related to this registry has to be reviewed for quality, for content, for confidentiality. And so NORD puts it through all of those paces to be sure that every piece of information sorry, I have dogs barking in the background. We have to be sure that every piece of information we collect is protected in the proper way. We have to obtain appropriate consents from every participant. All of this is very tightly regulated. And so in the United States, there's an international review board that they use to look at everything to do with this registry so that it is very well protected and the quality is extremely high. This is one of the reasons it takes a really long time. They have a basic questionnaire for rare diseases with about 453 questions that can apply to rare disease. And then we go through those. It's called a data dictionary, and we tailor it to Wolfram syndrome. So some questions do not apply, some questions do, and then we add in questions that we feel would apply to this disease. And then we have those reviewed by other researchers in the Wolfram syndrome community to help us make sure they really are applicable and appropriate. And so now we're nearly done with the process. We've essentially finished the data dictionary and we're on the last part of the journey to get this put into motion. It will be of the utmost importance to have as many of our Wolfram syndrome families and patients register as possible. The more families we have register, the more historical information we will have about the disease, which will allow us to learn more going forward about this disease. And we'll also have more information about the various subtypes. I think everyone's aware now that there is a huge variety in the way that Wolfram syndrome or Wolfram-related disorder presents. So the more families we can have register, the better. The registration, it will provide us, as I mentioned before, with hopefully an international list of clinical trial participants so that pharmaceutical companies or researchers will be able to more quickly move to a clinical trial. They will not have to gather this data on their own. You can imagine if it took us a year to set up this registry, how long it would take a researcher or an individual pharmaceutical company to gather that data about patients. So we become a more attractive population if they know we have this information ready to go. And so that should help us to get a pharmaceutical company or research group interested. I think that's most of what I wanted to say, but The link to this will be through the Snow Foundation, since they are the ones funding it. They will have the link. Right now, they're set up with an interest link so that you can log in to the Snow Foundation, and it will be up on the screen. It's actually a tab at the top of the page. It says Wolfram Syndrome Global Patient Registry, and you can express your interest, so you'll be notified as soon as it goes live, and we can start getting everybody registered. It will be a couple of hour process to enter your information in. Tracy knows. We've all been through it. I've been through it many, many times, so I forget how long it takes because I've gone through it so many times. But Tracy, how long would you say it took you on the prototype to get through it?
I think it probably took a good hour or so. I didn't go fully in depth in inputting all the information. I just put in basic bits because obviously I was asked for my opinion on the ease of completing it, and if there was any questions that perhaps should be changed or modified, sort of removed. So yes, I hold my hand up and say I didn't go as if I was filling it out properly. But even what I did do, it was quite lengthy, and that was one of my concerns that I did voice back to Sarah and to Stephanie. So
Tracy was incredibly helpful, as she always is, just with these details. I mean, no, it's so wonderful. So we were able to pare it down, make it more user-friendly. It really, I find as a parent of someone with Wolfram-related disorder, it made it, it was really interesting to be able to fill it out and express what we've been through. So in some ways it's therapeutic, but we also needed it to be very doable and not take 5 hours. So I'm remiss in not mentioning Pat Jabalisco with the Snow Foundation has been incredibly helpful working on the paperwork with this, forms, announcements, and going through the data dictionary, reviewing this. A lot of you will know Pat Jabalisco, incredibly active in this community and has been incredibly helpful. So we have worked to make this interesting, user-friendly, very doable. It does take a little bit of time to sit down and answer the questions, but it's quite interesting when you've been through this journey with a family member or yourself with Wolfram syndrome to be able to report in your information, knowing that that information will be part of this bigger project to really understand how this disease moves forward in our population. So we've worked to make it as user-friendly as possible while still giving great information for our researchers and pharmaceutical companies.
Wonderful, thanks, Sarah. I would say that one thing to sort of prepare our families or individuals for when they do come to filling it in is to try and have as much information as you can about things like if you can try and remember, when you're diagnosed with the different parts of Wolfram syndrome, sort of key points. I have to say I'm a bit sad. I've kept all of Jennifer's medical letters from the word go of this journey. So I've been able to go back and I was able to find the documentation that had her sequencing, the genomic sequencing for her to actually put in into the form. I'm not saying that many of you probably don't have that information still, especially if you were diagnosed or you're the person you live with, your family member, was diagnosed a long time ago. But it's helpful to have information to hand, but also you don't have to fill it all in at this one go. You can do bits of it, leave it, come back and do bits of it. Is that still this case, Sarah?
Yes, there's several parts to it. And I hope people aren't getting frightened by the sound of it. It's really not that labor intensive. No, it's not. It's really quite fascinating filling it out, but you can stop and come back to it. Some of you who have been in other patient registries, you'll find it's probably not as comprehensive or in-depth as some. I think there are some that are much more focused in certain areas. This gives a broader view of different parts of the disease, including the very medical parts, social emotional parts, general functioning in Wolfram syndrome. So it cuts across many different avenues.
Yeah, it covers all ages, so it's including
Yes.
your education and work life, if you're able to work. So it covers everything, and it is going to be very, very informative and helpful to pharma companies and researchers.
It's also quite nice that NORD set this up, since they've done this so many times with other rare diseases, to have a feedback loop in it for certain categories of answers where you can actually see how things go across the broader spectrum of people with Wolfram syndrome and ages. And they've found that people really like to understand the disease better quite quickly. And so it gives snapshots with graphs or diagrams to help us really understand the disease as we go. So we'll get some real-time information, which is fascinating.
Yeah, really helpful comparisons. So
yeah.
So it should be good. So have we got any questions or comments from anyone? We've probably scared them all off.
I feel like this, it's not that it puts Wolfram syndrome on the map. Wolfram syndrome is on the map, and it's been dramatically more so recently. More and more people are getting involved, getting interested, and a big thanks to Tracy for that with our Global Awareness Day coming up. But this moves us one step closer to having this data set that makes us a really good candidate for so many bigger groups in terms of finding treatments and progressing toward clinical trials. So it's an important step. I'm thrilled that Stephanie came up with it years ago, and that she really was willing to pursue it. So huge kudos to her and to the Snow Foundation for really moving this forward. It was no small undertaking.
No, I have to say, Stephanie did talk to me about it a few years back and said, you know, would I be there to sort of assist her when necessary? And I've done that with the feedback bit. And one thing we should also say, that it is obviously, it's voluntary. So, you know, don't feel that you have to complete it. Obviously, it's going to be really, really helpful to the global research pharma world to have this information. But it is voluntary, and all the data protection, because it's all being sort of assisted by NORD and everything, all data protection will be in place. So you don't have to worry about any of your personal information being sold off to a third party. So I just thought better make that point clear as well.
Thank you so much. That really, really important. And the fact that it is completely voluntary. Yes, I don't, I only pressure as a parent to say, oh, it'd be great to get as much information as we can, but there really is no pressure. It is absolutely voluntary. And the disclaimers in this registry will state that this is absolutely voluntary. And Tracy, I see a question here from Chantal Benjamin.
That's right.
That would we be able to answer it in another language, or is it mainly with checkboxes? So this is a great question, and we are working to have it in different languages. It will be translated. That is extremely important to us, and Stephanie has brought that up many times. It will depend how we get that done. We may have to do it through outside translators, or we may be able to do it through the National Organization of Rare Disorders. So we are still working out the details on that. But yes, that will be extremely important that we have it in different languages. And Tracy, where is Chantal from?
She's a support worker in Germany. Great. She supports someone with WS in Germany. She's on my database, so I know who she is.
Okay. So yes, we are working hard to get that done. Since it is an international registry, it really needs to be done. So.
Yeah, and that is one thing we are aware of, that there are many people, families and individuals affected that English is not their first language. So there will be ways, hopefully, of how we can do it. Tim's just asked, we may be able to link registries so that data already entered by people can be shared if all consent already has been given.
That would be fantastic. Thank you, Dr. Barrett, for bringing that up. That is a great idea. And I'm going to write down with my pen and paper right here, because one would think in this day and age we can do that. I am sure there must be a way, and we'll get to work on looking at that with NORD, because anything that saves time and effort and saves all of you time and effort. I know we are all so busy with the activities of daily life that if we can save time and effort to get this information in, we would need to do that. That's a great point.
Yeah, he sort of adds, obviously we need to test this out, because obviously in Europe, especially the UK, a lot of us has consented in part of Eurowab.
Yes,
so
exactly.
Obviously, if some of that information can be shared, and we just then have to update with further information that's obviously not been recorded on the Eurowab registry, that it will save time.
Yes, I looked at the Eurowab registry a while back, and of course we couldn't join it.
No.
And so that is a wonderful idea. I don't know why we didn't. Well, of course, Dr. Barrett would think about that. We didn't think about that. So to be able to have this all in one place, to centralize, have a central hub to this wheel, it would be phenomenal. So thank you, Dr. Barrett.
And obviously, as it goes, he agrees with that. And obviously, as it goes forward, us at WS UK will be more than happy. We'll have a link onto our webpage through to the global registry on a SNO website, so we can direct people through to it if they don't know where if they can't find the SNO Foundation website, or they're not sure they can see it from our website. So we'll make sure that we do that. So that'll be a way for people to be able to register with it as well once it's up and running. No point doing it just yet. So I think that's sort of what I know and I can contribute. Do we have any other comments or questions? Give people a little bit of time to perhaps type. No. Well, I think, as I've said with other presentations today, obviously this is going to be recorded. If anyone thinks of anything once we come off offline, then obviously please send me the email, or if you're in America and you're part of the SNO Foundation, then obviously you can directly email Stephanie or Pat at SNO. But yeah, any questions, then please send to me. I'll forward them on, and then I can send you the response.